अस्सलाम वालेकुम इय्याका नअब्दु व इय्याका नस्तईन। वेलकम टू माय चैनल डॉक्टर शामी सेज। तो आज से मैं SK17 सीरीज़ का वॉल्यूम 2 स्टार्ट करने जा रहा हूँ। तो लेट्स स्टार्ट विद द मेडिसिन 19th नवंबर मॉर्निंग पेपर। Question number 1, Down syndrome is trisomy 21. Under ADH, maximum absorption of the water is from the PCT. Question number 3, there is a history of the fracture patient's knee flexor relaxed. Examiner grasps tibial head with both hands. Leg moves anteriorly. Which ligament is damaged? That is the anterior cruciate ligament. Question number 4, the tractus solitaris receives afferent from the seventh nerve. Question number 5, the patient with the loss of touch sensation on the face while pain and the temperature being intact, which nucleus lesion is involved? That is alpha primary sensory cortex. Next, question number 6, a young man came, he has difficulty in the pharyngeal swelling. Which nerve is damaged? That is Charlie 5, 7, 9, 10. Next, question number 7, 1 liter blood loss, what physiological parameter will decrease? There is a stroke volume. Question number 8, an acute decrease in the arterial pressure elicits which of the following compensatory change? The decrease firing rate of the carotid sinus. Question number 9, at the time of the shock, what happens? What returns to normal after compensation earlier? There is a heart rate. Question number 10, regarding central retinal vein, there is a painless visual loss. Question number 11, which muscle fixes scapula to the medial border of the vertebral column? That is the rhomboid. Question number 12, small hand muscle of the hand is supplied by the rami of the T1. Question number 13, posterolateral boundary of the pelvic wall is formed by the sacrotuberous and the piriformis. Question number 14, which of the following condition is related to the lymphatic obstruction, cystic hygroma? Question number 15, the beriberi is associated with the low thiamine. Question number 16, the factor needed for the coenzyme A is which of the following? That is the pantothenic acid. Question number 17, the patient has the aphasia and the homonymous heminopia. Thrombus involves which artery? That is the MCA. Next, question number 18, the patient has the excruciating right leg pain, anterolateral right leg cordotomy was performed. Which tract was involved? That is the left lateral spinothalamic. Question number 19, the patient with epicanthic folds, mental retardation, protruded abdomen, which of the following is that is the trisomy Down syndrome. Question number 20, the 20 years old boy presented with the fever, headache, vomiting. He is having neck stiffness and altered mental status with the hallucinations. Which among the following is the brain eating parasite? That is the Naegleria fowleri. 21, the patient after swimming developed meningitis. Amoeboid movement of the histology sample, which organism involved? The Naegleria fowleri. Again, induction of the ovulation after pituitary craniopharyngioma resection. Which drug will be effective for the induction of ovulation? That is SCG followed by the GnRH. Next, 22, the patient came to the dental clinic having the mitral stenosis, is the hypertensive. Which prophylactic antibiotic must be given? That is amoxicillin. 50-year-old lady received a renal transplant from a cadaver. 1 month later, renal failure signs and symptoms were seen. She develops diarrhea and the hemoglobinurias. Some biopsy findings pointing to HLA1 association. Which cells are involved? That is CD8. Next, 24, the patient has the post-streptococcal glomerulonephritis type of the hypersensitivity type 3. Next, 25, the mechanism of the SLE is the autoimmune. 26, the regarding Mycobacterium leprae, which is through the intracellular acid fast organism. And next, question number 27, the TB test produced hypersensitivity reaction by which mechanism? That is a cytokine mediated. 28, the patient who has undergone ileum resection, what should be given? The vitamin B12. Pseudomembranous colitis is caused by which organism? Clostridium difficile. 30, the patient presented with a sore throat and membrane covering the throat. The membrane upon removal bleeds, that is diphtheria. 31, the frequency of impulse from the utricle is opposite from the opposite here. 32, the patient was known case of rheumatoid arthritis but now developed dry eyes, dry mouth. What is this condition? The Jorgen syndrome. Jorgen syndrome's marker is anti-SSA. Specific antibody of SLE is anti-dsDNA. Estrogenesis is caused by the lesion of which area? The parietal lobe. The conjunctivitis in the baby mother will have the chlamydia. The most common skin cancer is the Kaposi sarcoma in HIV patients. 38, the female travel from the cold area to Jeddah having buccal mucosal eruptions organism, that is HSV type 1. Next, question number 39, the luteinizing hormone surge 2 days before the evolution, 6 to 10 fold. Neural tube defects identified by the maternal AFP. Strongest stimulus for the gastrointestinal is the proteins and amino acids. The protein anabolism, fat catabolism is done by the growth hormones. The fat digestion is done by the emulsification, bile salts and the bicarb and the lipase. Next, 44, what happens in the esophageal sphincter when the peristaltic wave comes? The lags ahead of the wave. Median nerve damage superficial to the flexor retinaculum, which lean vesicle loss of the position of the thumb, which ATT is contraindicated in pregnancy. That is a streptomycin. The patient is the diabetic, hypertensive, and has heart disease. Prophylaxis of drug will be aspirin, scopidogrel. Next mechanism action of the clopidogrel is ADP antagonist. Blood is warm at 37 degrees Celsius for massive transfusion to cause the left to right shift. Next 50, the right shift of the hemoglobin oxygen curve. That is delta right option in this case. uh, Next 51, the gene that arrests cells in the G1 phase is absent. Which gene is that? That is the P53. Diagnostic finding of the metabolic alkalosis or the bicarbonate greater than 24. Metabolic acidosis mechanism is the loss of bicarbonate. The patient has the PA7.2, bicarb 16, and the carbon state 50. What is the diagnosis? Mixed metabolic acidosis. In the respiratory acidosis, the role of endothelium in the hemostasis is the prostacyclin. In strenuous exercise, what occurs decreased TPR? What part of the intestine thick loop with the less mesentery fat and the long vasa recta with her arcade? Surgeon asked while uplifting of the gut during the surgery, that is the jejunum. Next, the erythropoietin is secreted from which cell? The peritubular capillary cell. 59, that loop diuretics used is the pulmonary in the pulmonary edema. In relaxation phase of skeletal muscle, what happens? The sending of the calcium back to the SCR. The pregnant lady with deranged LFTs, which hepatitis could it be? The hep A. The patient of 56-year-old 56-year age in the chronic is the chronic carrier of the hep B from 10 years. He has now developed the fever and the jaundice. Delta antigen is positive. What does this indicate? The superinfection with the severity of the disease. HB surface and the core antigen positive. Core antibody IgM is positive to what is that? That is acute infection. Next, to treat the acetaminophen poisoning, which antidote is used? N-acetylcysteine. The woman took too many tablets of acetaminophen. What will happen to her liver after 3 days? There is necrosis. A center given the patient. What will happen? The increased bradykinin, decreased angiotensin 2. The patient having the temperature of 99, cold, clammy skin, sweating profusely, and working on a hot day, brought to the hospital in semi-conscious state is most likely due to the heat exhaustion. Next, the posterolateral wall of the heart is supplied by the left circumflex artery. Complete mole has raised. HCG. Patient present the pain in the lumbar region, stone of the pelvic urethral junction, pain rising from which segment? The T12 to L2. Motor aphasia is due to the lesion in the prefrontal cortex, which is the following is translocation seen in the CML, that is the 922. MHC1 differentiate in thymus to form the CD8, the hormone inhibiting FSH released by the testes. The therapeutic window of the drug indicate range of effective dose. Next, 76, the patient had the internal jugular lymph node biopsy in the neck region. After that, he developed the numbness of the earlobe. Which of the following nerve got injured? The greater auricular nerve. 77, the splenic engulfed dead red in the white cells by the red pulp. Next, 78, acute maxillary sinusitis required by the which bacteria? There is the Streptococcus pneumonia. 79, the flexor muscle tone is maintained by the red nucleus. Next, middle meningeal artery is the branch of the maxillary artery. The patient had the injury on the head. He remained unconscious for the short period of time. CT showed the crescent shape hematoma. Diagnosis, the subdural hematoma. Next, 82, the patient undergoing the thyroidectomy develops injury to the lower pole. Now develop the harshness of voice. Nerve injured in the vicinity of inferior thyroid artery ligation would be the recrolaryngeal nerve. Next, 83, the a 4-year-old boy was attended the clinic and was observed to have the short neck, low hairline on the posterior aspect of the neck, and was known to be suffering from the heart condition. X-ray showed a few cervical vertebrae, and the examination limited movement of the upper limb was noticed. Which of the following is the condition? This is basically the Klippel-Feil syndrome. Next, 84, the kyphosis involve which part of the spinal cord? That is the thoracic part. 85, the patient who is indulged in the demolition of the old buildings. Old buildings, that is an indication. The X-ray shows the interstitial fibrosis, and on histology iron staining of the cells. That's definitely asbestosis. A person got stabbed on the upper arm and the floor of axilla. Which of the following structure will be damaged? The intercostobranchial artery. Next, after gastrectomy, which type of anemia occurs commonly? That is iron deficiency anemia. Next, 88, the patient with the HB8, MCV 100, MCH 28. That is the normocytic normochromic anemia. An old man died after 4 days of the arteries having femur fracture. Upon autopsy, he was having the pulmonary infarcts and vessels were occluded by the hematopoietic stem cells, origin cells. That is the fatty embolism. In the post-streptococcal nephritis, finding the subepithelial deposits. The patient's abdominal surgery done. Now he developed the pulmonary infarction due to the pulmonary embolism in the medium artery. The edema in the CLG cirrhosis causes the decreased plasma collide osmotic pressure. What is the primary site of the DVT, the primary site of the DVT is the deep veins of the cough. The neutrophils, granulocytes increase in the cardiac infarcts. Most common site of the atherosclerosis is aorta. Hep B positive patient has rare AFB. He might be having the HCC. The 25-year-old patient presents the complaints of dizziness, shortness of breath, blue discoloration of extremities, cyanosis of lips and extremities noted. Which investigation should be done? That is the spectroscopic examination of the HB. Next, 98, the 32-year-old carpenter fell from the roof. The lateral longitudinal arch of his foot was flattened from the fracture and the displacement of the keystone for the arch. The falling bone is damaged, is cuboid bone. Next, 99, most important characteristic feature of the von Willebrand disease is increased bleeding time. Boy fell from the flight stairs, got skull fracture and when unconscious. Blood was in the nape of neck due to the damage of the posterior cranial fossa. Next, 101, in the presence of ADH, maximum urine osmolarity will be 1200. The 102, the pursuit movements of the eye is controlled by the cerebellum. Next, 103, the bar body per boiling of the pads preserved with the vitamin B1. Next, 104, the site of the murmur for the aortic regurgitation would be right second intercostal space. 105, the physician auscultate posterior inferior border of the lung in the back at the T10 on microscopy of the lymph nodes, biopsy specimen, granuloma with the caseous necrosis found to for the diagnosis of the TB. What we should be looking for? The demonstration of AFB. The cancer most prevalent in the male of the Karachi is the oral cancer. The superficial inguinal node strand directly follow the tract of the round ligament of the uterus. Basically, in last one you have to link the Karachi with Pan and things like that, and that is association of the oral cancer. Next, 109, the histology of the lymph node with the cuboidal epithelium is the Peyer's patches. Next, 110, the eclasia due to the defect in the mesenteric plexus. 111, the patient showing no improvement with the H2 blocker is likely due to the Zollinger-Ellison syndrome. 112, the which antibiotic interfere with the neuromuscular transmission, that is the gentamicin. Respiratory rate in the pregnancy increased due to which hormone, that is the progesterone. Ectodermal dysplasia, characteristic of the structure that will be affected has stratified keratinized squamous epithelium. 115, the perineoplastic action among the following is, that is decreased heart rate. 116, the Epstein-Barr virus caused which tumor? The Burkitt's lymphoma. 117, man with a hearing problem and was tested. He cannot recognize the source from which the sound is coming due to the effect in the lateral superior olivary nucleus. Next, the CA pancreas patient is admitted to the ward. His brother is not letting you tell the patient that the patient has the cancer because according to his the brother it would kill the patient even faster. At the evening, the patient's family is going to come to the hospital, discuss, and we will have to have a conference together. What will we do? Tell his brother that it will be dishonesty with the patient's family and the medical staff. 119, the group therapy in which the people are encouraged to learn from each other's behavior is called the interpersonal learning. The arithmetic average of the population is basically a mean 1 to 1. There were two drug groups. They were classified as the group A and the group B, but the doctors knew name of the drugs. Such study is called the single blinded study. In tissue flood is about 11 liters. Next, the viability of the sperms is 24 to 48 hours. Renal correction of the hyperkalemia leads to the acidosis. 1 to 5, the pronuclear cleavage after how many hours of the conception? 24 hours. What does the PR interval shows? The PR interval basically shows SA node conduction to the ventricles. 1 to 7, the patient has the femur fracture with the soft tissue injury. The shock occurred due to the insufficient blood volume. 1 to 8, the normal ECG with the long PR interval. The Mobitz type 1, that is 65 years old man having the fatigue, pallor, the weight loss, the golden yellow pigments in the liver which turn blue on staining. This is the lipofuscin. The patient with the MI died even after aggressive management, likely causes the cardiogenic shock. 131, the patient after RTA with the multiple refracture which of the following must be the first treatment? The fluid replacement. Rule of the somatostatin in the pancreatic fistula is the decreased secretion. 133, relay in the integration of the all senses in the thalamus. Ionizing radiations cause injury by the free radical formation. 135, the rational drug design is the alteplase. 136, the therapeutic use of the calcitonin is in the hepatitis. 137, after vasectomy, seminal fluid will contain the seminal and the prostatic fluid. Next, 138, the patient having the breast carcinoma have the history of another history of the mother, sister, maternal aunt gene BRCA1 causing carcinoma present on the nucleus. Next, 139, the young 20 years old skateboarder hits his head on the left side, initially alert but then became unconscious. CT brain show the crescent shape bleeding. On the parietal area, the artery vein involved would be the bridging vein. The male had the malignancy of the brain 1 year back, having the sagging face, dropping eyelid. Which part of the skull cranium fossa is affected? There is a petrosal part. Which of the following paraneoplastic syndrome is associated with the small cell carcinoma? There is the Cushing syndrome. 142. The fundamental defect in the SLE is the failure of beta and T cell tolerance to the self-antigen. 143. The shortest pro-erythropoietic stages of the Plasmodium falciparum. Next, 144. The 41% hematocrit means 41% of the formed elements are the RBCs. Arthritis and conjunctivitis, that is a combination of the Reiter syndrome, the squamocolumnar epithelium present 3 cm above the cardiac end of the esophagus, diagnosis the Barrett's esophagus. Next, climber at the high altitude experiences the hypothermia. On returning to the base camp, adapts to cold weather by heat generation due to which of the following? That is the posterior hypothalamus. Next, 148. The female presented with the weakness on the right side. CT scan shows the posterior frontal parietal and the medial temporal lobe, affecting which arteries involve the middle cerebral artery. 149. The female presented with the weakness on the right side. CT scan shows the posterior frontal parietal and the medial temporal lobe, affecting which arteries involve the middle cerebral artery. Next, 150. The 49-year-old man has the pulmonary embolism that completes the early blocks the blood for his left lung. As a result, which of the following will occur? There is a alveolar perspiration of oxygen in the left lung will be approximately equal to the perspiration of oxygen in the inspired air. NTD occurred due to the deficiency of the folate. Next, 152. The patient came with the left hypochondrium pan on the palpation. Splenomegaly was found. How will confirm the hypersplenism, bone marrow aspiration, the Chagas disease and the congenital megacolon effects? Which layer of GAT, the muscularis externa, direct inguinal hernia, is located medial to the inferior epigastric artery? 155. The patient is unable to tolerate the cold. Which test to be done to know hypothyroidism, TSH in the free T4? 53-year-old patient had the non-productive cough for the 2 months. A non-smoker now presented with the blood streak sputum. Left lung has the 5 cm hyalomass. Sputum shows the hyperchromatic pleomorphic cells with the scantic cytoplasm. The cause of this condition would be the radon exposure. Next, 157. Which of the following is last to appear normal in the blood after the hemorrhage? That is the RBCs. 150. The hyperexcitability of the neuron due to the deficiency of which of the following in ECF? There is the calcium. 159. ECG of the patient with electrolyte disturbance. U waves and inverted T waves go for hypokalemia. 26-year-old male presented to you with the surgical ER after penetrating into the right lateral side of the chest, and the mediastinum moves to the left side, and during expiration the shift toward the left side enhance which of the four is like diagnosis? That is the tension pneumothorax, because the mediastinum has shifted towards one side. Next, so that's all from this first medicine paper. Thank you for watching my video. Do subscribe my channel. Until my next video, Allah Hafiz.